What are the chances of getting scoliosis, and is scoliosis hereditary? Scoliosis involves the development of an unnatural sideways bending curvature that also rotates into the concavity. The curvature needs to be a minimum Cobb angle measurement of 10 degrees or greater to be considered as scoliosis. And again, there must be rotation into the concavity of the scoliosis is the most common type. A diagnosis is typically reached through combining a physical examination, typically posture evaluation, associated with x-rays to see what is truly happening within the spine. And normally we confirm the scoliosis with the x-ray and the Cobb angle analysis. The bigger the Cobb angle, the more severe the scoliosis is. There are different types of scoliosis that patients can develop. And normally when we look at different types, we look at normally they're classified based upon the type of scoliosis. The most common type of scoliosis is something called idiopathic scoliosis. And idiopathic scoliosis is when there's no known cause. 80% of all cases of scoliosis, either in adolescent or adult cases, are known to be this type of scoliosis, meaning there's no single cause that we can associate with the development of the scoliosis. The other remaining 20% are diagnosed as scoliosis cases are associated with known causes. And the most common of these is neuromuscular scoliosis, followed by degenerative scoliosis, and then congenital scoliosis. Now, these types of scoliosis are associated with causation. However, once you understand, not every single patient with a neuromuscular problem, not every patient with a congenital problem, and not every patient with a degenerative problem, it will develop scoliosis. So the opposite isn't true. When we look at neuromuscular scoliosis, it's typically caused by the presence of a larger neuromuscular condition. Neuromuscular conditions can affect the muscles, the ligaments, or the nerve system of the body. These are such things like spina bifida, muscular dystrophy, cerebral palsy, Ehlers-Danlos syndrome, neurofibromatosis. These are conditions that affect many systems of the body, and therefore it can lead to the development of scoliosis. Degenerative scoliosis is caused by abnormal age-related spinal degeneration, typically asymmetrical, and it's normally a cumulative effect over years and years and years of life that leads to the development and the diagnosis of scoliosis later in life. Normally diagnosed in women post 50 years of age that are normally either going through menopause or postmenopausal because of potential hormone changes that can occur to the muscles and to the bone density. Congenital scoliosis is caused by a malformed spine that develops in utero, and babies are born with an asymmetrical vertebra. These asymmetrical vertebrae can be wedge-shaped. They can be blocked vertebrae that kind of form in many bones that form into one, or it can be bones that don't fully form into one bone and remain into pieces. And even though it's rare, we definitely think that somewhere between 1 in 10,000 babies can possibly be affected with this type of scoliosis. Now, even though idiopathic scoliosis is by far the largest type of scoliosis, there's been a lot of data trying to search why does idiopathic scoliosis occur. And to really better understand the etiology of idiopathic scoliosis, they looked into many different components. And one common question, or the most common question I get from patients regarding idiopathic scoliosis is that, is it genetic? That maybe somebody in the family else has it and they have scoliosis, and therefore they're trying to say, okay, well, if I have it, my kids are going to have it, and we know that scoliosis is not 100% genetic. Despite all the years of research, there has not been a single gene or mutation that has been identified to account for the development of idiopathic scoliosis. We consider scoliosis now to be a multifactorial problem. And even though having somebody in the scoliosis is considered a risk factor for developing scoliosis, we know it's considered more than just familiar, it's more than just genetic, because they've done studies on identical twins. And then what they found, these are identical twins that have the exact same DNA, and we know that only about 60% or so of identical twins share scoliosis. The other 30 to 40% do not share scoliosis. So if genetics were 100% the cause, both patients would always share in an identical twin scenario, but it's not true. So it's familiar, and therefore there are some things that are happening. There is a genetic component, but it's not a genetic causation. We always like to say that families tend to share similar things: diet, lifestyle, responses to stress, locations, even posture could be shared in families. So there's some other environmental, multifactorial combination of variables that cause this scoliosis to start. And maybe genetics could be one of the risk factors that you could possibly be affected by one of these multifactorial things. things. But once the scoliosis starts and it starts to progress in adolescent stage, normally, regardless of whatever is causing it, we're dealing with the structural component. And regardless if it's a neuromuscular scoliosis, congenital scoliosis, idiopathic scoliosis, or even adult onset degenerative scoliosis, we're dealing with the scoliosis structurally. And the structural component is always the end result of treatment. So a lot of patients ask, if I knew the cause, by the time we diagnose scoliosis and find it, does it really make a difference? Ultimately not, because we're dealing with it structurally. And I always like to talk about the example, like, let's say theoretically a lack of vitamin D is what caused the patient to develop a scoliosis. Say we think it's a nutritional reason, and we find it when the patient is 13 or 14 years old, they have a 35 or so degree scoliosis. If I would give them all the vitamin D in the world, the spine wouldn't straighten up, because now it's become structural because they've grown with it. So regardless of whatever the multifactorial reasons that are causing the scoliosis, normally by the time we diagnose it, it's become so structural that we must deal with the scoliosis structurally, not really what caused it, because by then it may be irrelevant. So therefore, when we look at diagnosis, we definitely know idiopathic scoliosis is by far the largest group. We also know that it's estimated that somewhere around 5% of adolescents may be diagnosed with idiopathic scoliosis. But what we don't know is really how many patients that don't get diagnosed in the adolescent stage, because we know we don't catch them all. Because as age groups increase and as we look at older patient populations, we definitely know that the percentage of patients that also develop scoliosis also increase as well. So when we look at older populations, we know it's more likely for them to have a scoliosis. And when we look at patients like over 60 years of age, we've seen studies that can say somewhere 50 to 60% of patients possibly could have some type of scoliosis. And we know the onset of adult scoliosis isn't that great. So therefore, we know there's a lot of adolescent cases that go undetected. There was even one study that showed healthy adults over the age of 60 had a rate of scoliosis as high as 68%. So while we know scoliosis is more common in childhood to be diagnosed, we know it affects all ages. And scoliosis is considered familiar, but it's not considered hereditary. And even though there's a significant chance to develop scoliosis as you age in the adult stage because of abnormal degeneration and abnormal spinal health and well-being, we know true idiopathic scoliosis occurs in adolescent stage and may go undiagnosed. And you may even have it and not even know, and get diagnosed in the adult form as a result of pain or discomfort. So scoliosis unfortunately affects a wide number of people. And just because a family member has scoliosis, it doesn't necessarily mean you're going to develop scoliosis. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.